Kenya Red Cross Society started the year 2009 in earnest, stronger and more determined after a pulsating experience the previous year that was drenched in post-election violence. True to its mission, the Society straddled every inch and corner of the nation, responding swiftly and efficiently to a myriad of disasters, providing the much-needed relief aid, healthcare, water and sanitation services, and, in the process, establishing state-of-the-art technologies to meet the ever-growing needs of the 21st century. The year 2009 was historic within the Red Cross and Red Crescent movement worldwide. This was the year the General Assembly of the International Federation of the Red Cross and Red Crescent Societies and the 2009 Council of Delegates came to Africa and Kenya in particular, for the first time in the 150-year history of the movement.
Ladies and gentlemen, the Head of State of the Republic of Kenya, President Mwai Kibaki, Right Honorable Prime Minister of Kenya, Honorable Raila Odinga, the Vice President of the Republic of Kenya, Honorable Stephen Kalonzo Musyoka, Minister Naomi Shaban. I take this opportunity on behalf of Kenya Red Cross Society and on behalf of the 17th General Assembly of the International Federation of Red Cross and Red Crescent Societies to thank you for honoring our invitation as the patron of the Kenya Red Cross Society.
The 17th General Assembly marked a milestone for not only the Society, but for the movement as well.
We salute you, and we also want to express our appreciation and admiration for the work that you represent, and through you also the millions of volunteers who have over generations, one can now say, given the IFRC and in a sense the symbol of the Red Cross and the Crescent Societies in a world often driven by conflict, facing natural disasters and catastrophes, has so often been a beacon of light. Very often the first in place when something terrible or tragic happens, often the last hope for people when they are in their most desperate moments in their lives.
Our gratitude, therefore, also goes to your government for its permanent and respectful collaboration with our brother and sister of the Kenya Red Cross Society. Thank you also for solving suffering in Africa by helping us to hold this General Assembly in an African country.
The number of people hit by climate-related disasters is expected to rise by about 50% to reach 375 million a year by the year 2015. Humanitarian organizations have to come up with responses that encourage people to be self-reliant and not dependent on handouts. Red Cross has a unique credibility and a unique influence that could help people.
It is significant that for the first time in its history, the General Assembly is being held in Africa. As a patron of the Kenya Red Cross, I wish to express my appreciation for the material, financial, and technical support extended to us in the times of crisis. The Kenya Red Cross Society has become a household name, and whenever there is a disaster, the Red Cross Society is always at the forefront to complement the government's efforts in tackling the same.
The climax of the event was a change of guard at the helm of the International Federation of the Red Cross. The president of the Japanese Red Cross, Tadateru Konoi, took the mantle as the new president, succeeding Juan Manuel del Toro, the president of the Spanish Red Cross.
Research indicates that all human ancestry can be traced back here to Africa. And so we are all brothers and sisters with the same blood in our veins. How then can we not share the same dream? With the far shores of globalization, we can find that shared ideal called humanitarianism. I believe it, I dream it, and I'm sure you join me. Thank you very much indeed.
The Kenya Red Cross Society Governor, Paul Birech, was elected the Vice President of the IFRC for Africa.
African national societies must provide leadership in meeting the humanitarian challenges in the continent. This will be possible with appropriate leadership, vision and commitment. The meetings confirmed that the problems in Africa need an African solution grounded on accountability, transparency and dialogue.
Africa is not all about doom and gloom. It happens on a tremendous scale, but they're also very lovely human beings going about the business of life. So I'd like the delegates to go away with a positive impression.
At the end of the successful event, guests were treated to rich African culture and entertainment. There was plenty to sample from the African culture and dance.
Internacional de la Cruz Roja y de la Media Luna Roja, señor Tatateru Konoe.
This was also the year when the Kenya Red Cross Society hosted the 5th annual general meeting of the new Partnership for African Red Cross and Red Crescent, bringing together various Secretary Generals of Africa's Red Cross and Red Crescent societies.
Our vision and our mission, therefore, from South Africa when we started in NEPAC, was one, that NEPAC would be a club of excellence. In other words, only those who are committed to good governance and good management and are willing to subject themselves to regular audits will become members.
Red Cross, Red Crescent, and your activities are synonymous with human challenges. Invariably uninvited, you're always there, ready to join government, to join NGOs, to do the good job that you do. In this country, our Red Cross was a small, laid-back organization until this great man joined it. Abbas has distinctively transformed the Kenya Red Cross into a phenomenal organization with phenomenal successes that we now, as a government, proudly say is our equal partner in handling situations that require emergency support services.
Despite the daunting preparation of the General Assembly and Council of Delegates Conference, the Kenya Red Cross staff and volunteers did not rest on their laurels. Disaster management once more underlined the Society's activities that unfolded early in the year. There were fiery tragedies across the country that left behind a trail of destruction and death. Quite evident was the joint response by various institutions that embodied proactive collaborative efforts nurtured during the recent years.
It is a torturous wait around here.
Very true.
Can we be able to just have access to this building so that our loved ones are found?
An oil tanker exploded in Sachangwan in Rift Valley province, killing more than 200 people and leaving hundreds with serious burns. The Kenya Red Cross personnel were amongst the first to arrive at the scene and provided search, rescue, first aid, tracing and psychosocial services.
Wote ambao walishiriki pamoja nasi kuangalia watu wa hapa Sachangwan na Molo wamesaidiwa.
An ocean wind-propelled fire engulfed Faza Island, leaving more than 2,500 people homeless, many of whom had not known life beyond the island. Relief was direly needed, and the Kenya Red Cross worked jointly with the government and other well-wishers to assist the affected populations. Tragedy after tragedy followed, and the society responded with equal measure. There was an oil tanker explosion in Samutet, Kericho, road accidents, urban fires, the collapse of buildings in Nairobi, Kiambu, Kisii and Mombasa. The Tsunami Recovery Project made substantial gains in empowering residents along the coastal regions to be better prepared in case of a tsunami disaster.
Wataalamu wametuelezea tsunami itatokezea kando kando ya bahari. Kuna wale wenzetu wanavua samaki. Tungependa watusaidie na information.
For almost the entire year, close to 10 million people in the country faced starvation, following prolonged drought that claimed lives, dried water bodies, and decimated crops and pasture across the country. The Kenya Red Cross launched a humanitarian appeal and received overwhelming support from the government, members of the public, the media, and the corporate sector.
We have been having discussions with Kenya Red Cross as members of the MOA, and this morning what we want to do is to completely associate ourselves with the sentiments and with the program that the Kenya Red Cross has demonstrated to us.
A new chapter linking scientific knowledge on climate prediction to field application for disaster risk reduction was written with indelible ink. After a successful sensitization exercise in the villages, a seed distribution program was undertaken in lower eastern and coast regions. The community-driven distribution of certified seeds and fertilizer was executed in a more transparent and timely manner. And the bumper harvest was a phenomenal achievement.
Kuna mbegu ambao tulikuwa inatoka kwa shirika la Red Cross, na wakati mvua iliponyesha, shamba yangu ikatoa mahindi yote, hakuna yenye ilioza, ikatokea vizuri, ikawa na mazao mzuri vile mnavyoona. Hatukukuwa tunajua kama tutapata chakula kama vile tumepata, lakini wakati huu tuko na shukrani.
As Kenyans were still counting their losses after a severe drought, the skies opened up with torrential rains. As El Nino rains caused massive floods that claimed lives and displaced thousands of people.
We have now, in this particular camp, over 200 displaced, and it's very early on in the season. We will have interventions that will include distribution of food, distribution of non-food items, and health and water and sanitation interventions.
The Kenya Red Cross worked with like-minded partners to offer healthcare services throughout the year, through program and during disaster response activities. The first aid program made tremendous gains during the year. Hundreds of people were recruited as blood donors, and the society took a leading role in the mobilization of blood to the National Blood Bank. There was diversified dissemination of HIV/AIDS messages and home-based care that benefited those infected and affected by the virus.
Stigma iko juu sana na watu wao wanachaguliwa vibaya sana juu akiathiriwa na mambo ya ukimwi. Lakini I'm positive for 5 good years now. Red Cross anatufanya, anatusaidia mambo ya chakula, mambo ya materials nyumbani. Pesa kidogo ya kufanya biashara yenyewe mimi nimepata, na tuna training mingi sana nimefanya Red Cross, home based care nimefanya, memory book nimefanya.
Psychosocial support was offered across the country, both to the young and the old. In northeastern region, the Dadaab community received quality health services thanks to the Garissa Integrated Project, implemented by the Kenya Red Cross. The Malaria Home-Based Management Project helped improve health services amongst targeted rural communities. A cholera outbreak in more than a dozen districts in Kenya was an acid test in the health sector. The Kenya Red Cross worked closely with other stakeholders to access health services to populations in hard-to-reach areas, to curb the spread of the disease and the loss of lives. Provision of clean and safe water was a Herculean task undertaken with a mark of excellence by the Kenya Red Cross in collaboration with various stakeholders.
we're immensely pleased to be working very closely with both the government, the local community and the Kenya Red Cross. And it's all about teamwork on something like this.
So far this water has helped us in a way or the other because we are no longer drawing water from the rivers.
In Kenya, about 60% of the population cannot access clean and safe water. Technological innovation came in handy as the society and partners enabled rural populations to access water using the mobile phone M-Pesa system and solar energy. After years of devastating floods that destroyed infrastructure and crops worth millions of shillings, the Ramu Hydro Project, implemented by the Kenya Red Cross in 7 divisions of Mandera district, provided the right antidote.
Red Cross wametusaidia, tulipewa na Ireland minini pampe moja zamani, hiyo ameshinda kututosha. Tuliuliza Red Cross, wametupatia hii pump, tunalima mahindi, kitunguu na nini na nyanya.
It is very nice to see that with small means it is possible to do good things. If this had not been done by you, the local people here, we would have had flooding here again and again, and with this small means we have been able that you could sustain and stay here in a good way, and that's very important for the people to stay where they are.
The Field School program, a unique and participatory initiative in disaster management, offered participants real field operation opportunities.
Lita 20 za maji unaweka dawa moja. Ukisha ngojea kwa hizo dakika 25 hadi 30 ndio utaanza kufanya nini? Kutumia hayo maji.
The National Society received invaluable support from the partner member societies to build capacity at the headquarters and regional level.
I wish the best success to the office and the best success to Kenya Red Cross branch here in Kitui, and also good neighborly relations that I already understand have been established.
We now have fully established our 8 regional offices, which are fully functional. We have employed competent staff in all of them. We also have functioning boards. This has greatly contributed to efficient service delivery at grassroots level. Regions are now able to build or strengthen the capacities of the branches to respond to disaster-related and health emergencies. Prepositioned stock are even in the regions, and therefore this has enhanced service delivery.
The Kenya Red Cross continued to build capacity amongst the volunteers and youth across the country by providing the much-needed skills and opportunities for these vibrant groups.
How many signs of symbols of protection? Which one and which one? Red Cross and red.
2009 was indeed historic. The movement commemorated 150 years since the Battle of Solferino and the founding of the idea of volunteerism. Other events marked during the year were the 90th anniversary of the founding of the International Federation of the Red Cross and the 60th anniversary of the Geneva Conventions. All national societies actively participated in Your World, Your Move campaign. 5 youth represented the Kenya Red Cross during the Solferino celebrations held in Italy. In business development, a promising Emergency Plus medical services unit was born to provide efficient and reliable health services. By the sunset of 2009, the Kenya Red Cross Society had achieved a major milestone in its strategic plan, thanks to the governance, staff and volunteers whose invaluable support transformed the nation's humanitarian face.
All these achievements would not have come in a vacuum. We have 240 people on long-term contracts and 450 on short-term contracts. These staff are matched to their jobs. That means that we recruit people for the right jobs. We have staff from top management, up to the lower levels, volunteering to carry out many activities that come up for the society.
We are very happy to be able to make a lot of projects together with the Kenyan Red Cross. The Kenyan Red Cross, which is a very strong national society.
I sincerely wish to encourage you to go on doing this good work and urge members of the public and institutions to support the work of the Kenya Red Cross.
Ningetaka vile vile kuwashukuru chama cha Msalaba Mwekundu, maana mara moja walijitolea na wabunge wote wa Pwani kwa umoja walivyoshikana na kusaidiana na wafanyabiashara na wakaazi wa Pwani kutokea kwenda kuwasaidia wakaazi wa maeneo ya Lamu.
Red Cross imesaidia sana wakati huu kwa kutoa blanketi na mambo mengine haraka kusaidia wakati huo.
I want to add my congratulations to what Minister Saitoti has just said about the Red Cross. We are truly proud of the efficiency of the Kenyan Red Cross chapter. Asoba na Gulet ambaye kila wakati huwa katika mstari wa mbele kusaidia wananchi.
The media coverage of the Kenya Red Cross activities was breathtaking.
The Red Cross Society says more than 30 people had.
According to the Red Cross disaster preparedness,
Kenya Red Cross reports have confirmed at least 11 more deaths in the region, with over 20 more cases of suspected cholera also reported.
Millions of people in the world are proud of the positive contribution the Kenya Red Cross Society has made in their lives.
When it seems all hope is gone, when people